key points will be part of the poop transplant study of 10 blood cancer patients. For the first time in patients with severe graft-consequence-ev-house, fecal microbiota transplantation was tried. It has shown that treatment is 90% effective in the treatment of another bowel infection. Healthy intestinal microbiomas are used in the first poop transplant attempt of Australia, which aims to save the lives of serious patient blood cancer patients. A fecal microbiota transplant involves transferring patient without an intact intestine biote to help the trillion intestinal germ from healthy person's feces and improve immune response. 10 blood cancer patients will be part of an experiment conducted by the Qimr Berghofer Medical Research Institute in Brisbane next year. FMT, donors' immune cells after a bone marrow transplant of recipients' organs and tissues when attacked the severe graft-house mansion house home It has been tried for the first time in living Australian patients. According to the Australian Cancer Research Foundation, 11,500 Australia are diagnosed with blood cancer every year. These diseases, which constitute one of the 10 cancers diagnosed national, take 4,000 lives each year. Qimr Berghofer scientist Dr Andrea Henten will lead a work to use a FMT product developed by the Australian Red Cross Canblood at the Royal Brisbane Hospital. Dr Henten hopes if intestinal microbes of experiment hold key to a positive immune response to GVHD and treat disease. Bone marrow transplant can be a double-edged sword, said. GVHD patients are usually hospitalized for a long time and are dependent on immune-suppressing drugs that do not work in half of cases. If doctors can restore a healthy intestinal microbiome in patients, they can potentially treat GVHD more safely, safer Hent. FMT is a really exciting new approach that can save lives. The feces are collected from voluntary donors after meticulous scanning before they are process tested in a TGlisans facility and then sent to health research facilities. He showed that treatment was 90% effective in the treatment of another bowel infection, and Red Cross Lifeblood Executive Director Stuart said his organisation was excited to be a part of the new research.